Hi, I'm Cindy Lovelace. I am a NET patient, also an advocate, and the co-founder of the Healing NET Foundation. My presentation today is entitled Living a Life with NET Cancer, because I'm obviously living my life, but I'm doing so while dealing with a very complicated cancer. And I've subtitled this, Oh, the Choices. What, when, how, who? And you can probably identify with that. I also want to point out that my opinions and perspectives are my own, and it's about my own care journey. And while they include information about specific treatments and physicians, I am in no way making any recommendations. They are only used to illustrate what I have learned. And of course, your journey is your own. So like most of you, I had never heard of neuroendocrine when I was diagnosed incidentally in 2011. I wasn't sick. I was enjoying life with my husband, Gene, with frequent sails on Old Hickory Lake in Nashville, enjoying a family that was extending with grandchildren, and I had just started working for a nonprofit that raised money for cancer research. I was also celebrating 6 years of being free from breast cancer. I was certainly not expecting the sudden and actually inaccurate pronouncement that a neuroendocrine tumor had been found, but I was told, quote, not to worry. They are almost always benign. This mysterious tumor was found in the tail of my pancreas, and it was the size of a small grape. It was pretty disconcerting for my trusted breast cancer oncologist to tell me she didn't know a lot about this particular tumor. They're very rare, she said, but she did refer me to a crack surgeon. And suddenly I was having some pretty significant surgery, especially for not feeling sick. I had a distal resection, removing the tail and about half of my pancreas and my spleen, quote, just in case, said the surgeon. I was told I was lucky the tumor had been found and that it was small and unlikely to have metastasized. And again, I was pronounced cancer-free. In the short term, I had some recovery to do and eating adjustments to make. I was now considered pre-diabetic because of the pancreatic resection, and also I had a lessened ability to break down foods. I was encouraged to add enzymes to my diet. I already had a decent eating lifestyle, I guess. I had made adjustments after breast cancer to eat less fat, more veggies, more fruits. But I did begin to notice that really sweet desserts bothered my tummy. But that was okay. I liked salty snacks anyway. Okay, back to nutrition in a moment. And of course, I had Googled information about neuroendocrine cancer. But what I found in 2011 was pretty depressing and confusing. And quite frankly, I didn't go a lot further. I had just started a new job. I needed to get back up to speed. And being a former news reporter, I already had a pretty healthy distrust of the internet. And besides, I trusted my doctors. So I made a decision to just move on with my life. I didn't know what I didn't know, and neither did my doctors. Then 6 months later, my husband and I just happened to be watching CNN when the bulletin came over about the death of Steve Jobs. To this day, I thank Dr. Sajay Gupta for getting this story right. He didn't talk about liver or pancreatic cancer. He named it correctly. He said Steve Jobs had neuroendocrine cancer, and that got my attention. I did make a choice to go back to Google again, like right that moment, but hey, I was panicking. But this time, whether you call it a God wink or just pure luck, a neuroendocrine specialist popped up first in my search. He was also located right in my city. In fact, it turns out Dr. Eric Liu was a close social friend of my breast cancer oncologist. She just didn't know he did neuroendocrine surgery. Dr. Liu had trained in Sweden under Dr. Kjell Oberg, one of the world's leading researchers in neuroendocrine cancer, and he was now practicing at Vanderbilt in Nashville, Tennessee. I was fortunate enough to get a consult within a month, and I cannot stress enough that this decision completely changed my NET cancer journey and likely saved my life by multiple years, and I'm still counting. When I met Eric Liu, I was impressed by both his intellect and his easy and patient-friendly way of explaining a very complicated illness. He also ordered an octrea scan, which was the gold standard of NET tumors at the time, and recommended an MRI of my liver, and all of those scans looked good. But he wasn't completely satisfied, and he recommended my enrollment in a new clinical trial for a scan called gallium-68, explaining that this scan used a radioactive contrast that could light up neuroendocrine tumors in someone like me who had an expression for somatostatin receptors. So I found that I had another decision to make, and I signed up for that clinical trial. I think in retrospect, I simply trusted that I had found the right doctor at the right time, who really knew this rare disease, and I needed to pay attention to that. Sure enough, the gallium-68 scan revealed that I had 2 small tumors in my liver. The octrea scan and the MRI had not detected them. Now, as you may know, the FDA approved this scan in 2016, and then a few years later, the copper-64. And both are now considered a gold standard for neuroendocrine tumors. So I had another decision to make: remove them now or watch and wait. Let me emphasize, I had a surgeon tell me that it was okay to watch and wait, or I could also do the surgery. He left the choice up to me, and that impressed me. It made sense to wait a while. Dr. Liu had explained that even a primary neuroendocrine tumor the size of a small grape, like the one in my pancreas, can still metastasize and seed the body before it's removed. And usually the liver is a primary target. So he predicted that I would likely have other tumors show up down the road. So how many times do I want to have invasive resections on my liver, i.e. like whack-a-mole? Once, twice, 3 times, 4 times, 5 times? And my primary tumor had been low grade, i.e. slow growing. So I waited a year or 2, and one tumor closest to my heart began to grow a bit more rapidly. When it was 3 centimeters, I chose to have the surgery. And I also had any other tumors that were found at that time, and sure enough, some cousins had shown up. I had them resected as well. Fortunately, I was able to have this surgery done laparoscopically. And I felt it was the best decision for me at this time because the biggest tumor was such that I really needed to have it removed. And I was pretty healthy at this time. I did not have carcinoid syndrome, although I had become aware that other patients suffered horribly from this because of the excessive output of hormones from their tumors. So I had become a lot more educated about neuroendocrine, and I had discovered that there were organizations that were working hard to distribute information about NET cancer, like LACNETS, led at that time by Giovanna and Bessie, who was also a survivor, and my colleague Josh Mailman, who blogged and ran a patient advocacy and support organization, NorCal Carcinet, Carcinoid Cancer Foundation, Neuroendocrine Cancer Awareness Network, and Caring for Carcinoid, now the NET Cancer Research Foundation. I attended patient conferences, I perused websites and blogs offered by those organizations, and I had looked at videos, and now there's virtual conferences. I asked more questions of Eric Liu, and I educated my own doctors, including my oncologist, my GYN, my primary physician, my GI doctor, even my skin doctor, who were fortunately pretty open to the information, or I was just really persistent. I didn't realize it at the time, but I was advocating for myself and educating others in the process. I also discovered some gaps in education and awareness of this disease. I was particularly struck by the fact that if I had not been gifted by my oncologist, by her telling me she didn't know a lot about this cancer, instead of telling me that she knew all about it, and if I had not found a specialist and trusted his advice versus assuming all my doctors just know what's best for me, and if I had not done my own research and found good vetted information about this disease, I would be in a much different and darker place. My former reporter instinct kicked in. Communication is key. People need to know so they can make informed decisions, and doctors need to know so they can make informed suggestions. So that's where this other icon here, HealingNet Foundation, comes in. In 2013, I co-founded the HealingNet Foundation with Dr. Eric Liu to advocate for awareness and education among patients, caregivers, and physicians. It was very important to me that all parties be involved in this education process. I recently retired as the executive director, but I continue to advocate in the neuroendocrine community. So I want to talk about caregivers for a moment. My husband is my caregiver. He has been a listener, an encourager, and he has been involved in as much education and decision-making as he can stand. I can't possibly understand what he goes through, but I acknowledge how completely overwhelming it must be. But we both agree it's very important for him to be educated and a participant in my healthcare, no matter how emotionally and physically hard that may be for both of us. Like hanging out in a surgical waiting room for 10 hours when the surgery was only supposed to take 6 hours. Like trying to understand all the terminology and accompanying me to conferences where physicians and patients talked about some really scary stuff, including quality and quantity of life. I'm fortunate he kind of gets it. After all, his career was in healthcare. But on the other hand, it was in hospice healthcare. And as he told Dr. Liu early on, look, my world is like this. When a patient has had a secondary occurrence of cancer, they are my hospice patient. You need to tell me that's not what this is. Caregivers are gold, and they need to be acknowledged and supported as much as the patient. So I recommend this publication, Navigating the Net Patient Journey, which includes a caregiver section that was contributed to by LACNETS' own Lisa Yin. And NorCal Carcinet's Josh Mailman also contributed to a section on insurance, which is key to both patient and caregiver education of this disease. The publication can be viewed or ordered at thehealingnet.org. And there is also another publication specifically for high-grade patients and their caregivers on this same website. Now I want to focus on physicians as I continue to tell me about my own journey and how I made decisions and choices. Shortly after my surgery to remove some initial tumors from my liver, I asked about the possibility of taking monthly octreotide shots, as I had learned this not only lessened carcinoid syndrome symptoms, but might also slow down tumor growth. Again, my NET specialist laid out the pros and cons. The cons being that any medicine can give you side effects. And they also give it to you in your bum. And no, I'm not going to show you a picture of that. And how do you ascertain over time that it actually did slow down the growth when you already have a slow-growing tumor? But it was my decision, and I decided to throw another dart, i.e. a butt dart, at this cancer and just see how it goes. I started the monthly shots and continued on them for years, and when it was approved, I even tried lanreotide for a while. And I want to emphasize something else here, that to date, I am not aware of any data that shows one therapeutic value of one over the other, i.e. octreotide versus lanreotide. I see that question in patient forums all the time. The determining factor, in my opinion, is which one works best for you. Which one has the less side effects and is easier to tolerate when it comes to getting a butt shot. In early 2019, I made the choice to have another surgery. Those pesky liver tumors kept coming back, and although Dr. Eric Liu had moved to Denver, I continued to consult with him through my local oncologist. We discovered from another gallium-68 scan that one tumor had grown to almost 4 centimeters. And believe it or not, it had an evil twin that had been hiding behind my gallbladder. You see, my first surgeon who did the pancreatic resection was not a NET specialist and didn't know that the gallbladder often gets removed during cancer diagnosis. So I still had mine, and I had a major liver debulking. I had my gallbladder removed. 14 tumors were removed from my liver, along with a few freckles that were now growing in my mesentery. Scans after the surgery showed success on the liver, but there were still some tiny ones left behind, a few tiny ones around my right ovary, and as I mentioned, the mesentery. So I began asking questions of my surgeon, of other patients, researching the latest systemic treatments versus more whack-a-mole surgery, which of course was still an option down the road. And I was particularly interested in whether I would be a candidate for one that had been recently approved by the FDA and everyone was talking about, PRRT, peptide receptor radionuclide therapy. Yes, nuclear medicine, and that sounds a bit daunting, maybe even scary. But remember, I was an early receiver and believer in a nuclear-based scan. So I decided to consult with a physician who had been on the forefront of this treatment's initial approval in Europe. She was now at Memorial Sloan Kettering in New York. I had been able to go to Denver for surgery, so why not New York? And I had family there who I could stay with while I was undergoing the treatment. After consults with Dr. Lisa Baudet, who felt I was a good candidate and was already known to have a good uptake in the somatostatin receptors, I chose to have the treatment beginning in late summer 2019 and into early 2020. And initially, I had a great response. The initial scans after treatment showed shrinkage, and in this case, that's very good. But after about a year, the tumor started misbehaving again and at a bit more rapid rate than they had before. And yes, that was disheartening. But one bit of good news in this fight with neuroendocrine cancer is that research is ongoing and has really ramped up in the last decade. I mean, a lot, since 2011. And I continued to do my research and be involved in the patient community, meet physicians through my work, and so I was educated enough to know that there were other options. I had also been following the work of a new oncologist in Nashville and decided that if I needed another systemic treatment for my NET cancer versus another round of PRRT or more surgery, then perhaps I should bring an oncologist who specialized in NET cancer onto my care team. I was still seeing my breast cancer oncologist, and while she deferred to whatever my NET doctor said, at one time she told me, "You know more about it than I do." Nope, I'm not a doctor, and I don't need to be acting like one. So I consulted with Dr. Nanu Das in 2021. And after much discussion about that with my care team, about different options, more PRRT, liver-directed embolization, maybe surgery, I decided to start CAPTEM oral chemotherapy regimen, which has been shown to be effective specifically in treating NETs that originate from the pancreas. Admittedly, I was scared. The chemo that I had had with breast cancer in 2005 was tough, and now I was 15 years older. But I tolerated it okay, constantly monitoring my blood counts, and as of today, my tumors have shrunk significantly. It was also helpful to once again be talking to an oncologist who knew NET cancer in my own hometown. I continue to be scanned and monitored because I've accepted this difficult truth. I am not likely to be cured of this disease. So let me repeat that. I am not likely to be cured of this cancer. I'm now 65, and that's really hard for my family and friends to hear because they want to hear that I'm cancer-free. They want to hear that I've kicked cancer's butt. And face it, that's pretty much what we hear in the media and in many cases in the medical world. An oncologist exists to make a patient cancer-free. So what do we do with that as NET patients? Yeah, it's hard, it's not fair, but I do it best when I let that go. And I focus on the education, continue to educate myself, ask questions, believe in and draw hope from other patients and caregivers, surround myself with doctors who live and breathe NETs, or at least doctors who are willing to listen to doctors who live and breathe NETs, and focus on what brings me hope and joy and serenity. And I want to point out something that I think is pretty obvious here. I have shared a lot of information in this presentation about my diagnosis and my treatment. I do this because I knew from the beginning that it was going to be important for me to do so when I had made a decision to co-found a nonprofit that focused on NET cancer education. But I choose where and how much I share of this information, just as I did in this presentation. I think about it all the time. And I want you to do what feels best for you, because it's your choice as well. Do not be pressured into sharing or not sharing. Do not allow anyone to make you feel guilty about it. Trusted patient forums will value your privacy. And I'm also going to make another comment that may not be popular with everyone. I was originally angry about celebrities who did not share about their diagnosis. I mean, who knows how many people they could have helped, right? Who knows? But who knows what any individual is going through when they are diagnosed with a rare and tricky cancer like neuroendocrine? Who knows what family or peer pressure they may deal with, vulnerability with an employer, or how tired they may be of media scrutiny. Anyone diagnosed with cancer should not be judged by what they choose to reveal. They've got enough to deal with, whether they're a celebrity or just someone like me or you. So you can't do any presentation without throwing in a few bullet points. So here's mine to recap some of the perspectives that I've tried to get across in telling my story. Education is a never-ending and necessary ally. Keep it active. Surround yourself with doctors who really know NETs or are willing to talk to doctors who really know NETs. Let go of the ones who don't. Trust your doctor's voice when you know they know what they're talking about. Get second opinions when you aren't sure. I brought together a care team, and when one would tell me one thing, I would talk to the other one, and yeah, it's okay. They get that. Choose a caregiver, and that may not always be your spouse. It might be another family member. It may be a close friend. And once you know you have the right caregiver, thank them. Avoid comparing yourself to other patients and the treatments they choose. We are all different. We all have different choices to make. And I want to mention here that nutrition is a big part of that uniqueness of you and your cancer journey. And those who deal with carcinoid syndrome have different types of diets than someone like me who does not deal with that syndrome and does not deal with having to make those particular choices. So the best way that I've learned to do this is to keep a food journal and just notice what foods agree and disagree with me and make my choices there rather than comparing myself to other patients and what they have found works for them when it comes to nutrition. Explain your journey to your family and friends and then just let it go. It's not up to you to determine how they're going to receive that and how they're going to process that. And remember that this is your life. Make your best decisions about your care and how much you share, and then live your life to the fullest that you can, whatever that looks like for you. Now, I would like to dedicate this presentation to my friend and colleague, Giovanna and Bessie. Her courage and her choice to share her own journey for the greater good of the NET community is why this conference is happening right now. And her vision and her work continue to make a difference. I love you, Gio. Thank you.